Have you guys heard about that girl Heparin? She's an anticoagulant used to prevent blood clots.
I heard that sometimes she can be really mean and induce thrombocytopenia.
What's that?
It's when there are decreased platelets in the blood.
What should I watch for when using heparin?
Well, because she can decrease platelets in the blood, tests should be done often to check hematocrit platelet counts and blood in the stool.
So can everyone take heparin?
Heparin's pretty amazing, but it isn't for everyone. She shouldn't be given to alcoholics, menstruating women, patients 65 or older, or patients with cardiovascular conditions. Also shouldn't be given to patients with gastro conditions or hematologic conditions.
Oh.
I used to think heparin was pretty fetch because she treated stuff like arterial embolisms, pulmonary embolisms, and venous thrombosis.
Well, I heard that when you're using heparin, you should tell your doctor if you have any bleeding, such as bleeding gums, blood in your stool, or black stools. I also heard that abnormal symptoms can last for weeks after stopping. Ew.
She's so versatile. She can be given through an IV or subcutaneously in the stomach, 2 inches away from the umbilicus. She can also be given in the thigh subcutaneously. Heparin has a lot of amazing qualities, but I've heard she comes with some administration considerations. You should look for signs of bleeding and hemorrhage in patients taking heparin, and she can't be taken orally or intramuscularly. While someone's on heparin, you should definitely check their APTT frequently to determine blood clotting time. Also, heparin can get a little crazy and cause bruising, so injection sites should be rotated to prevent development of a big bruise.
She is so iconic, but I've been told she has some pretty bad adverse reactions. Sometimes she can cause fever, headaches, and even anaphylaxis. I've also heard that she can lead to bad bleeding, dizziness, sometimes even chest pain. I once had a friend with her, and they said she made them have hyperlipemia, rhinitis, and even black stool. Ew.
You should teach your patients to watch for signs of bleeding, to rotate injection sites, and to use soft bristled toothbrushes and electric razors.
Heparin doesn't get along with everyone. She can increase bleeding risk when taken with other drugs that affect platelet function and coagulation, like warfarin, aspirin, non-steroidal anti-inflammatory drugs, and thrombolytics.
And when it gets really bad, protamine sulfate can be used to keep heparin in check.
One time, heparin prevented me from getting a blood clot. It was awesome.